Now we'll quickly try to move to the next concept, which we'll be discussing as related to abnormal heart sounds we can actually hear on auscultation. So this is what is known as the holosystolic murmur. Holosystolic murmur. Okay, so the holosystolic murmur is known as a pansystolic murmur. You can see this is an image trying to show it. The first one is a holosystolic murmur. So it's a heart sound that lasts throughout the entire contraction phase. Like throughout, when the heart is contracting, you have this heart sound. So that's from the first heart sound to the second heart sound. It's typically caused by blood leaking through a valve that is defective. So timing begins with S1, continues till S2. Is uniformly intense. Is best heard at the mitral apex. Okay, that's the apex, or the tricuspid area, or the left sternal border. Okay, so mitral regurgitation murmurs often radiate to the axilla. Tricuspid regurgitation murmurs radiate to the left lower sternal border. That's if it is a mitral valve affected or the tricuspid valve affected. So common causes: it could be mitral regurgitation, where blood is leaking from the mitral valve. It could be tricuspid regurgitation, where blood is leaking from the tricuspid valve. It could be ventricular septal defect, where there's an abnormal connection between the two ventricles, which is not supposed to be there. So patients will also be weak, having difficulties in breathing. So these other things should help you to further know that it is it. Then signs of heart failure, palpitations, and they are becoming bluish in the lower extremities to show that oxygen supply is not reaching tissues that are far adequately.